We now welcome Dr. Abdul El-Sayed to our program, physician, epidemiologist, public health expert. He's a progressive activist, and he's author of the new book, Healing Politics, A Doctor's Journey into the Heart of Our Political Epidemic. Right off the top, Doctor, is this healable?
Ask me on November 4th. Look, I think there's a lot of work that we're going to have to do to be able to heal the moment that we're in. And, in the book, I talk about this idea of an epidemic of insecurity that has left us all anxious, worried about the future, driven by a systematic lack of basic resources. And it won't end on November 3rd just because of the outcomes of one election. But it's going to be a function of everything that we can do from November 4th onward to try and rectify the lack of access to basic goods like healthcare and housing and high quality infrastructure and jobs that pay a fair wage that too many people are living without right now, particularly in the context of this pandemic.
It's back to school time. What do you say to parents who are asking, should I send my kid to school?
The hard part is that is an answer that really depends on a lot of things that are individual to those parents. And I'll say this, that in public health, there is never one yes or no. Very rarely there's one yes or no. But it's a question of how much risk is worth the circumstance. Now, in some communities where there's still very active community spread, the risk of sending your kid back to school is a lot higher. In communities where there's not very much community spread, obviously it's a lot lower. Is the school and the school district doing what it takes to prevent transmission in that school? Are they requiring masks? Are they, improving the quality of their HVAC system? Are they doing as much as they can outside? And then how important is it for that kid to go to school? And what are the risks if, in fact, they do get sick or someone in the family gets very sick? Some children are living in multi-generational households where they've got elderly parents and grandparents who really could have a very, very bad if, in fact, they got sick. Other kids need really specialized education that they can only do in person. And I think for every family, they need to weigh the risks against the needs and make a decision for themselves. But I would always say that being able to make sure that your kid is wearing a mask at all times, that school district has a real plan around what to do if there is a case, how to prevent that first case from happening. And of course, paying attention to what the circumstances around school is in the transmission around the community. Those are all really important things to do.
Doctor, top White House officials are urging the nation's governors to persuade the heads of colleges to keep the students on campus, even in view of the pandemic. What do you think of that? Sounds weird.
Absurd. Look, I'm teaching this term at the University of Michigan, and I elected to take my class fully online. I really enjoy teaching, and I wish I was able to do it in person. But I also know that that for college age students, the ability to learn online via something like Zoom is a lot higher than for younger kids. And every day that we keep colleges and universities open while there's active spread on those campuses in particular, we are increasing the risk for every other person who lives in that community. And, that means then that, kids who really do need to learn in classrooms, like kids in kindergarten or pre-K, are not going to be able to do that. And so, colleges and universities are not the most important institutions to keep open right now. And it's worrying to me that this seems to be more in line with a political agenda driven by the White House than it does to be in line with science and the public health interests of the communities.
COVID-19 has already claimed the lives of more than 183,000. How much worse could it get?
It would get a lot worse. I hate to say it. It could get a lot worse. There is no silver bullet to COVID-19. Even a vaccine is not a silver bullet because, of course, there's a difference between a vaccine and a vaccination. And we know that 50% of Americans say that they wouldn't take a vaccine right now because they're worried about the process that created it. And so it doesn't matter if you theoretically have a vaccine if people are not willing to take it. So there's no silver bullet. What we need to do is basic public health. We need to invest in testing. We need to invest in contact tracing. And the fact that we're not doing that as a society, particularly as we go into the fall, as schools open and colleges and universities open, and we move indoors because it's getting colder outside, the risk of a serious increase in transmissions is always there. We saw what happened over the summer. And the last thing I'll say is that when we're worried about deaths in particular, watching what might happen with a concomitant flu increase could be really, really serious, particularly for the highest risk patients, who, of course, are folks with pre-existing conditions and the elderly. And so this is not a good situation we're walking into right now, and it could get a lot worse, and we have to remember that.
Do you see any cause for optimism?
I always see cause for optimism, Larry. I believe that we've got a choice about the leadership that we want, and I believe that if in this country we are willing to put science ahead of the political aims of a particular president, if we're willing to invest in basic public health, if we are willing to forego some of our own creature comforts so that those who need to be able to be together, to learn and to engage in society, if we're willing to do all those things, then we can keep this virus at bay. Look, we're at any time, we're within a month of vastly taking down the transmission, but it has to be because all of us decide that we're going to be a part of the solution. So long as we have people who are trying to divide us and to politicize this virus, we're probably not going to get there. But the fact that we could make that decision, the fact that we could stand up and decide that we are going to take this thing on, that's always cause for optimism, and I'm never going to give up on that hope.
What degree of confidence do you have in the pandemic data?
I'm confident in the data that we have right now. I worry that there is a lot of attempt at political interference, but right now I am confident in the data that we have. That being said, the directions that this White House has taken, taking the data responsibilities away from the CDC and centralizing it with some corporation in Washington, D.C., the impact, the pressure that they put on the CDC to change guidelines, the appointment of a neuroradiologist who is a doctor focused on imaging the brain rather than epidemiologist or an infectious disease doctor as the top White House advisor on COVID-19. These are all really worrying. And so while I'm confident that the data we have right now is legitimate, I worry always about the political interference with that data, and that we all have to be vigilant, particularly the journalists and the Fourth Estate, to make sure that those numbers are real and that they can be depended upon, because we need to know what's happening in our society with one of the greatest disasters in modern memory.
Now, we've been hearing a lot about the convalescent plasma as a treatment. Exactly what is it? What are the pros? What are the cons?
So convalescent plasma is a portion of the blood of people who have had COVID-19. And in that blood, so it's the part of the blood that doesn't have cells in it, right? So not red blood cells or white blood cells. But in that blood, there are a lot of other things, including antibodies. And the reasoning goes that if you give patients who are actively struggling with COVID-19 some of that plasma, that the antibodies inside of that plasma will be able to tune their immune systems to COVID-19 and help them beat it. Now, this is a treatment that is often used with different infectious diseases. It's being used right now. The question is whether or not the FDA should have given it an emergency use authorization, because right now the data that we have to show that it is effective is really limited and problematic. In science, there are good ways of answering a question and there are not so good ways of answering a question. And the question of, is this effective for reducing death and disease to COVID-19 has only really been answered using some of the not so great ways. And we need to wait until the best ways of answering the question yield data and look at that data and make a decision. And the worry here is that rather than following the science and the best answers to that question, there has been political pressure to produce a set of solutions. We saw the president rush to extol the virtues of hydroxychloroquine, only to see that actually, when we looked at that via randomized controlled trials, that it was not effective. And in fact, the side effect profile was far worse in patients with COVID-19. And so we've got to wait for the science. And so with convalescent plasma, science is just not there yet. And this is really worrying that we're seeing the politics push the process rather than the science.
The annual flu shot is here. Should everybody get one?
Yes, everyone who is indicated to take one, unless your doctor tells you you shouldn't take one, you should be taking a flu shot. It is really, really important to remember that just because COVID-19 is the disease that we're all focused on right now does not mean the flu has gone away. And it is really important that people do what they can to protect themselves from a disease that could make COVID-19 far worse.
Supposing you have COVID-19, do you still get the flu shot?
So that's a question for your particular doctor to answer. For most people, the course of COVID-19 is going to be self-limited. It's the symptoms will go away, and at that point, it's really important to talk to your doctor. Obviously, for people who are having a serious illness and they're under direct medical care, their doctors are the best place to make that choice. But even if you've had COVID-19, which is the circumstance that most people are going to be in, you should get a flu shot.
Doctor, if this is going to get worse, how bad can it get?
It could get a lot worse. And I just want to explain why. The best estimates tell us that in order to get to quote herd immunity, the amount of sickness that we would have had to have is about 60 to 70% of people would have to be immune because they got the disease. The best estimates tell us that even in New York, one of the hardest hit parts of the entire country, the number of people who've had it are about 20%. And on average across the country, you're looking at single digit percentages. We've had 185,000 deaths, and we've only gotten to single digit percentages of people who've had the disease and potentially are immune. And even then, what we're starting to understand is they might not be immune because we have cases of people having gotten it now twice. And so what that tells us is that if you had to have 10 to 15 times more disease, think about how many more people would die. But the good news is that there's so much more we can do. Basic public health, contact tracing, testing, masking, social distancing, all of these things can bring the transmission down. And I remain optimistic because at any given time, we're a month away from being able to tamp down the number of cases if we're willing to invest in doing these basic things with public health. So yes, it could get a lot worse, but it could also get a lot better.
Dr. El-Sayed, thank you so much. We always love talking to you.
Larry, thank you so much for having me. It's always a privilege.